From Hollywood to healthcare, technology used to make movies is being used at the University of Rochester Medical Center to help scientists understand the brain and how it ages. As 13 WHAM's Norma Holland tells us, what they learned could help predict a person's risk of developing Alzheimer's disease.
Researchers in the Mobile Brain Body Imaging, or MOBI lab, attach wires to a cap covered in electrodes. The cap picks up the brainwave activity of a volunteer, while infrared cameras surrounding him pick up how his body moves on a treadmill. This lab is one of 12 around the world, combining motion capture technology with brain scans in real time.
What we're saying is, let's get people up, let's get them in a walking situation where they're solving a task, where we can kind of stress them a bit, and then we can ask, how's the brain working under duress? And that gives us a window into function, maybe, again, like a neural stress test, like akin to the cardiac stress test.
Armed with that information, doctors hope to one day be able to predict a person's dementia risk a decade before symptoms show up. It can also help give clues about a person's risk of falling as they get older.
We all see it, and there's certain folks as they get older, you start to worry about them. You see that their gait and their posture is deteriorating, and you know that they're not as sharp, that they're not able to flip their mind from one task to the other, to get a little perseverative and so on. And the #1 killer of people over the age of 65 in the US is falls. Not heart disease or cancer, those are very important issues, but just simply falling down, and you end up in the hospital, you end up with a secondary infection. We all know this story.
But the story doesn't have to end that way. The work here is still very much experimental, but researchers feel confident the information gathered could, within possibly a decade, end up at a doctor's office near you. Norma Holland, 13 WHAM News.
The technology will also help doctors understand other conditions like autism and Parkinson's. The hope is that one day the technology will be wearable, so patients won't have to go into a lab. Researchers are looking for volunteers, and if you're interested, you can call the number on your screen, 275-16.